We
I
got
love it when I
all
get
the
things
I's
done.
dotted and all the T's crossed.
Yes, I love it when I'm able to get a task done. I'm a task person. So when it's done, I'm like, yes, yes, I feel relieved. Alrighty. Welcome, welcome, welcome. Welcome to the two Sista Docs spilling the tea.
Yeah,
And I like saying that name. Hmm.
I was just setting my Facebook so that I can also make sure I tag people on there. So,
Yeah, that is true. And that way you can tell me if for some reason it's not going right. But it should be good. It should be good. And so we do this every Wednesday unless we have a company call that's knocking us out. In fact, I'm going to be in Martha's Vineyard next week, and I am going to pull away to make sure we still do this Wednesday night because that's how important this is.
yes.
So I am excited to have you guys on here. Looks like Atlanta, Georgia. That's Daryl. Hey, Daryl. Cora, Dr. Cora. Oh, I'm so happy to see her on here. And Alan's in. Okay, great, great, great. Now we have some two special guests that are going to tell you their remarkable stories tonight. So excited. And tonight it happens to be all women. You know, it's not always all women, but what's wrong with it being all women sometimes talking? Nothing. Absolutely nothing. I love being with my ladies. Maybe that's because I went to an all-girls college. You know, I kind of love the camaraderie, the sisterhood. So, but still, we're the ones running the households mostly anyway. So those men go to the doctor because we tell them. So this is the right place. You're in the right place tonight, man or woman, child. No matter where you are in the country, you're in the right place. So I am Dr. Tiffany Marie, and clearly I had enough of my Unimate today because I can go. I'm on like 100. But I'm actually a board certified family and lifestyle medicine physician. I did private practice, I did urgent care, and then I ended up doing telemedicine for 4 years or so across 48 states. So I got to see, yeah, we are struggling. You know, these statistics we're going to talk about, those are real statistics of people who are dealing with these conditions we're going to actually dive into. And so for years, I was just handing out the prescriptions. I know Dr. E understands me, handing out the prescriptions, telling people what to do, and not seeing enough change. Too many people still were coming back to me with big buckets of medications, coming to see me like they're going on a weekend getaway. That's not how it should be when you go to a doctor. And too many people weren't getting healed. So that's when I decided to get into lifestyle medicine. I started talking on social media because I figured it's a whole bunch of junk out there. I might as well add some positivity to all this negativity out there and just talking about lifestyle changes. And I got connected with Anne Marie, who changed the whole course of what I was doing. Showed me about these natural products, and I have been talking about them, the lifestyle changes, and left traditional medicine to do this full time. And then I got to meet wonderful people like Dr. Esther here and our guests we're going to have come talk. And without further ado, let me introduce you to this wonderful woman as she introduced herself. So tell us, Dr. E, tell us all about you.
Hi, thanks, Dr. Tiffany. As you heard, my name is Dr. Esther Ngare. I am a board certified family medicine physician practicing out of Houston. And I started this just over a year ago, in January last year. I had Dr. Tiffany talking on a family and friends lunchtime call in January, and I was sold for myself, and it didn't take a long time for me to realize that this was something that was going to be helpful for my patients too. And I've come a long way because one of the things that I keep saying is that when we're taught how to treat chronic disease, we talk about starting medications, and not just chronic disease, it becomes chronic medications too. People are on these medications and we just keep adding one and another one to treat either the side effect or to continue controlling the symptoms, because that's what we do. When you think about it, you start with one blood pressure pill and in 2 years you're on four. What does that tell you? Are you really treating, or are you just trying to push this blood pressure down against whatever odds there are that are keep trying to keep it up? So that's what we were taught. But then I realized there's actually a different way. You can actually treat and heal and actually not have to deal with these medications. And that now has been the dilemma I'm facing. How do you have this conversation about you don't need these medications anymore? Because even I, as a physician, mentally, I still have that thing. you're supposed to be on this for the rest of your life. But now I am telling you, you know what? It doesn't have to be that way. And you've got to the point where you don't need to be on this. And that's why we're here doing this, because we know that people being on medications, they're not thriving. They're not living their best lives. They just, this is what I have to do, and this are the effects. This is just, we keep talking about you look at how does it make you feel versus what is it controlling. So you may feel like crap, but hey, it's keeping your blood pressure down, so it's keeping your cholesterol down, so you just have to bear it, keep taking it. But no, there's another way. You can actually thrive and still keep these conditions at bay and actually make sure that you are not escorting you with all these medications towards a heart attack or towards a stroke in the, eventually, that we can actually pull you back from that eventuality. That's why I am doing this. And I love doing it with my sister here, Dr. Tiffany, because we see the vision, we see all the possibilities out there for ourselves, for families, for friends, and for pretty much everyone, because, you're a patient or you're not, but everyone could be one, but everyone doesn't need to be one. So, yeah.
Yes. Yes. Entirely true. Entirely true. So, one, Dr. Esther and I can do this forever, but we are so excited that we get to have other people come join us. So it's not just us talking to you, because we can do this. This is what we do all day long. I mean, we decide this is what we want to do with our lives to begin with. I want to help people get better.
Yeah.
How much better is it that I'm actually able to see those labs get better? I'm actually able to see before and afters like Jackie. When I show you all this picture, y'all gonna be laughing with me too. It is phenomenal. It is phenomenal. But so I'm not going to talk too long because I want Jackie to tell her story, because when I tell you this story is something that you want to hear, if you are watching this on Facebook and you're like, oh my gosh, I don't know if I need to tag people, you need to tag some people. Jackie's story is going to touch some people as well as Michelle's. And if you're on this Zoom, same thing. Start getting people on here because we have a wonderful story. So I'm going to let Dr. Esther introduce Jackie, and I'm going to get out the way.
Okay, Miss Jackie. Miss Jackie she's somebody who, when she told me her story, even I had my mouth open, because again, this is not something that I thought could actually happen. And I like Miss Jackie, she says, I couldn't make this stuff up. Yeah. No, you can't make this stuff up. And Miss Jackie has had a phenomenal story. Think about this. Back pain. Back pain is probably one of the most complained about symptom. It's one of the things that causes a lot of cost burden, a lot of human burden. People can't go to work. People can't do their chores at home. They can't take care of their children. They end up being on medications, which unfortunately cause addiction in some cases. It's one of those things that it can tear families and communities apart. And most of the answers we have don't always give 100% recovery. And patients are not always thriving after that. But Jackie's story is different. And the reason why this is special is, and you'll hear it, is just because in the most unlikely way, Jackie is able to live her life to the fullest. So without spilling any beans, let Miss Jackie take the hot seat. Welcome, Jackie.
Hello, can everyone hear me? Hi, my name is Jackie Brown, and I'm a foodie. Okay, no, I know this isn't Foodie Anonymous, but I have to start my story off that way because my love of food really kind of colors some of my testimonies involving the Feel Great process or protocol. I was actually introduced to this protocol by my soldier sister girlfriend, Beverly Grandison, who is also a partner on this protocol back last year. So a little background about me. Last year, I was the heaviest I've ever been in my entire life. I was 210 pounds. I didn't weigh that much when I was carrying my children during pregnancy. And so I went to a meeting that Bev invited me to and heard all these wonderful testimonies and thought, okay, well, yeah, it sounds great. So I was given samples, and when somebody gives you a sample, you're like, okay, I'm gonna hold on to it. So here comes, this was August, here comes September, and I'm like, oh my goodness, this is September. I have a doctor's appointment coming up. I know I haven't been doing anything. Oh my goodness, y'all see that? I haven't been doing anything. And every time I go to the doctor's appointment, that scale is going up a little bit more. And I thought, oh my goodness, man, I got this sample. Let me just knuckle down and do the samples. So I did, I actually did the protocol hard. I followed everything word for word for 3 weeks. And within 3 weeks, my doctor was able to see that I had lost weight. And not only had I lost weight, but my numbers had started going down. And so the doctor said, whatever you're doing, continue to do it because it looks great. I mean, everything looks great. And so I was like, yes. So fast forward, now we're in April. Um, and so within the first 3 months, first 4 months, I lost 25 pounds. But let me tell you all, I think I'm the poster child for what not to do. Because along the way, what I did was I was testing the product every chance I got. Pound cake for dinner. Okay, let's just think about this. Okay, I'm diabetic. Well, they say I'm diabetic. 8 o'clock at night, and I decide in November on and I call it November. That's when you're going into holiday seasons with all the desserts and everything. But it's 8 o'clock at night, pound cake for dinner. Yes, I did. Don't judge me. I already told you I'm a foodie. So what happened was it's 8 o'clock at night, and I decide I'm an old-fashioned Southern girl. I had a huge hunk of pound cake, and I just thought, if I'm going to do it, I'm going all in. I had the pound cake, warm it up in the microwave 15 seconds, melts in your mouth. But what I did was, prior to the pound cake, I took the balance. And I drank the balance and I had the pound cake for dinner. And the next morning, I woke up, my blood sugar was 87. I can't make that up. And so when I saw that, I was like, what? Met who? I'm not taking another metformin. I'm not taking another dose of metformin. And I did not. And so from that day to this, I have not taken any metformin, but I continue to check my blood pressure not blood pressure, but my blood sugar every 2 to 3 days, just to make sure that it has not gone up. True to form, it has not gone up, but my love for food has not gone away. And here comes some more foodie stories. Cheesecake for dinner. Oh my goodness, Logan's has the best cheesecake with the crumbs on it, and then it has the caramel and the strawberries. Cheesecake for dinner. My blood sugar the next morning was 94. Just recently in Houston, another cheesecake for dinner from Papacito's, and that was excellent. My blood sugar the next morning was 94, again 97. So I just can't make that up. And all that to say, man, okay, that's disrespectful eating. It really is. But as disrespectful as I've been to my body, this protocol has been true to what it says it was going to do. But so that was one thing, just the eating. But one other story I want to tell you is this. Around the pound cake episode, I started to take notice of, okay, wow, you know what? My arm is not tingling. What was happening is this. I was previously diagnosed with a condition called congenital spinal stenosis. And for those of you who don't know what that is, let's say this is your spine. And so what happens is congenital, that means I've had it from birth. But if this is your spine, what happens is your your spinal column, I'm sorry, if this is your spinal column, then your spine is closing in on your spinal column. Now let's just consider this. I have osteoarthritis in my lower back. I have congenital spinal stenosis. I also have bulging disc with inflammation in my back. So here comes my spine closing in on the bulging disc. And so it was very uncomfortable. But the way it manifested itself in my body was that I was having tingling in my arm. And it really feels like if you ever lean on your arm for a long time and it feels like your arm falls asleep. And when you wake up, I mean, when you go to move your arm, it's just tingling like spider senses or something. Well, my arm was like that nonstop. It was going down to my legs. Well, around the pound cake episode, I noticed, wow, you know what? I don't have tingling in my arms anymore, but I'm still in my mind thinking that I'm going to have to go ahead and have the surgery because normally the circumference between around your spinal column is anywhere from 9 to 18 centimeters. That's the normally acceptable range. Mine is 7. So I'm still preparing myself that in February, I'm going to have this surgery. And the surgery was going to be so intensive. It was a 4-hour surgery because my entire cervical spine is the one that had the stenosis. So that meant from the base of my neck well into my back was going to be cut open. They call it a laminioplasty, where they were going to have to cut open each bone, put in a spacer so that I could have more space around my spine. I actually showed up for pre-op because the 12th of February I was supposed to have the surgery, and the doctor was just looking at me. He said, man, your symptoms are reversing themselves, and it really makes no sense to have the surgery. I actually was sitting there getting ready to argue with the doctor before I said, no surgery. And then that's when I was just like, oh my goodness, wow. Thank the doctor for his integrity and his honesty. But so what I know is this: prior to the doctor saying no surgery, the only thing I had tried other things. I had done the steroid injections; they didn't work. The doctors were then talking about ablations where they were going to have to, burn my nerves or whatever. And I was like, oh no. So what I know then is this. Number one, the feel great system is all right. Number two, I can't make any of this up. I'm getting a t-shirt made saying that. And number three, the number one, I can't make this up. Number two, the feel great system is all right. And I always like to end with make your day great. I'm sorry, I thought I was on a post. But anyway, hey, thank you all for your time. I'm open to questions.
Thank you so much, Miss Jackie. I love Miss Jackie's story because she really captures the essence of this. Life happens. And that's why we do this, because you can't always have everything all prim and proper, that all you're going to eat are your veggies and there's not going to be cake, because what is life without dessert? So dessert is going to be there.
Let me show these pictures, because so Miss Jackie gave me some pictures and I didn't get a good chance to put them side by side. So let me show you. So this is the first picture, right? And so you got to see the reveal.
That was May of last year.
Okay,
And
so let's go back.
Just 2 weeks ago.
May, same dress, and 2 weeks ago. Okay. What I love is I love the face. I love Jackie. She comes with all the emotion, all the extras. I love it. You can't make this up. I love it. I love it. Thank you so much. Please encourage Jackie on her journey in the comments. And I'm sure there's some more of you that have some great stories. And if you want to share, put that in there also. But I appreciate you for getting on here and sharing your story, because it's not easy. Go ahead, Jackie.
I'm sorry, I forgot to say one more thing. As far as the disrespectful eating, and just the protocol being true to his body. Pound cake for dinner, I still lost weight. I lost 28 pounds and still losing. Pound cake for dinner. My blood sugar went from 6.8 to 6.4. That's as a result of disrespectful eating. Just consider now in 2026, I'm eating a whole lot better, and my progress and momentum is going to go a lot faster because I'm slowly getting away from that fixation on the sweets and all that unhealthy eating. I just want to say that. Sorry, Dr. Tiffany.
No, you're fine. You're fine, Jackie. Now, so what is the goal? Is the goal to keep eating the pound cake? No, but this is a real person There are people that have real life situations, and sometimes they're going to still be on that pound cake until they're ready to come off. I like how you said you're now starting to get the desire. I'm not going to do that as much. I love it. I call it my transition thing. I like to say it's what my couch potatoes can do when they aren't able to exercise. And so they can start using this. Now they get the energy. And so when you do come in, let's make sure we mute our phones. And Jackie, your story is great, but let's talk about why we're even here. What is going on? Are we just talking about sugar? No, absolutely not. We're actually dealing with something that happens even before sugar starts to happen. So insulin resistance. So I like to say beyond the A1C, beyond that point to where your doctor's like, you have diabetes or pre-diabetes, 10 to 15 years before that, you are dealing with all these other symptoms that I'm going to talk about. So lots of times when we say insulin, when we're on social media, when we're talking to people, immediately everybody just says diabetes and they say, I'm fine. I don't have pre-diabetes. I don't have diabetes. Oh, but I heard you complaining about, fatigue, joint pain, all these other things, right? But insulin is plays a huge role in our metabolism. It actually but determines how we burn our fuel, whether or not we're going to use fat for fuel or whether or not we're going to burn sugar for fuel. Okay. And so what are these symptoms I'm talking about? It's important for us to understand that all these symptoms are actually related to insulin resistance. I mean, you see obesity, specifically that weight gain around the middle, because that's where when insulin is high, it's going to store that fat around the midsection around your organs. Neuropathy, that's that numbness and tingling in the fingers. Erectile dysfunction, migraines. Alzheimer's disease is even called type 3 diabetes because of its link to insulin resistance. High blood pressure, heart disease, high cholesterol, fatty liver. So many people are having fatty liver now. This is a thing that is just being pushed like crazy. And it used to be just related to alcoholism. No, we have kids with fatty liver and they're not drinking. So clearly it's not the alcohol anymore. Polycystic ovarian syndrome, the leading cause of infertility amongst women. And then the big C. Yeah, the big C. Cancer cells love sugar. So definitely related to insulin resistance. And you have all these other symptoms on the side, the inflammation, the skin tags. Everybody thinks, oh, that's just genetic. My auntie had them. My grandma had them. I'm just going to have those ugly things on my neck or under my arm. Absolutely not. Sleep apnea. I mean, all these things. And so if you sit here and look at this list and you think about the people in your life, I could promise, if I was a betting woman, I would bet that everybody on here knows somebody who's dealing with this. And you have somebody that you actually want to share this information with because too many people are struggling. And so a normal A1C does not mean that you have low risk. No, absolutely not. So an A1C is a number. It gives you a percentage of how much of your red blood cells are covered in sugar. Okay, that'd be a simple way to say that. And it gives you an average for about 3 months. So it's not a spot check right then. It gives you a good average for 90 days. And so we have ranges. Normal is A1C less than 5.7. That would be in a normal range, okay? For sugar, that'd be normal. But I'm going to talk to you about how that's not really normal necessarily. And then pre-diabetes, 5.7 to 6.4, that's when, okay, pre-diabetes. And then diabetes, 6.5 and above. So what we are finding is that the range that I was taught to keep my patients in for their A1C, I mean, we were kind of told, they need to be around 6.5 or less than 7, and that's like the American Diabetes Association guidelines. Well, if you look at the numbers I just showed you, that means we were actually taught to keep them in the diabetic range. Okay, how problematic is that, right? Well, between 4.8 and 5, this is when your cardiovascular risk is the lowest. And when I say cardiovascular risk, I'm talking about the heart attacks, the strokes, the things that take us out of here. This is when it's the lowest. I didn't know too many patients that were able to stay here, not just with medications, no. And then 5.1 to 5.4, the risk starts to increase. Still better than 6.5, right? But it's starting to increase. And then 5.5 to 5.6, now you're knocking on that pre-diabetes door. And your doctor, when they actually care about what's going on with your health, they're starting to have their ears perked up. They're like, okay, we got to do something. And then 5.7, I mean, your pre-diabetes, this is when they're a lot of times starting your own medications. So some people are like, I wasn't even diabetic. I was that borderline thing, because borderline was what we called it before pre-diabetes became an actual diagnosis. And now they're being started on metformin, the leading prescription for type 2 diabetes and other medications. Okay. So how did we get here? So we had this crazy food pyramid. that had us eating 6 to 11 servings of carbohydrates, right? So it was a lot of frequent refined carbs. If you go back to that old pyramid, you not only had that row for the 6 to 11 carbohydrates, then you had a row for the fruits, then you had a row for the sweets. So 3 out of those, I want to say 5 levels were carbohydrates. Well, no wonder we're struggling with diabetes, pre-diabetes, fatty liver, and all those things on that picture. Okay, the frequent refined carbs end up spiking the glucose, and that makes your pancreas have to release insulin. And if insulin has to keep doing that, it's going to be flooding your cells with insulin. And so over time, your poor cells are going to get resistant to that insulin. In fact, they downregulate the receptor so insulin cannot bind there because it's just too much floating around. But way before you start having problems with your sugar, you have high insulin in your bloodstream. And high insulin in your bloodstream actually damages your blood vessels. It actually damages your ovaries. That's how you get the polycystic ovarian syndrome. It can act like a growth hormone. That's how you get the skin tags and the dark patches on your neck. You know, that's not dirt for a lot of people. A lot of times it's not dirt. The darkness under your eyes. That's from insulin behaving like a growth hormone. And then you have the things with the cholesterol. It makes your liver make more cholesterol. Okay. And then it also, like I was mentioning
Dr.
earlier,
Tiffany,
when that insulin is too high,
Doctor, just to let you know, you're not sharing any slides, just in case.
I was talking all this time. My slides were good too. Daggone it. Okay. Dang it. I like them too. Okay. I was just going to town too. You guys just let me go to town. Nobody spoke up. Oh, well, let me bring them back. Well, I hope that you guys still followed though. Did you guys still follow?
Yes,
Yes,
we were
we did.
following Dr.
Yeah.
Tiffany.
Okay, good. Good. So it wasn't totally a waste, right? Oh man. Now I go speed through everything. Oh man, you guys didn't see my picture. I like this picture. Oh, anyway. Ah, so when insulin's high, it ends up making you store fat around your midsection. That's why you see more of that weight around the midsection. And people who are like, I just can't seem to lose that spare tire, that has to do with the insulin being storing that fat there. Okay. So when we're talking about insulin as a hormone, this whole issue with the fatigue, the energy, the spare tire, the sugars, the trying to get the energy to do the activity, that's not necessarily willpower. You're fighting the hormone. You have got to fight the hormone the right way. And that's going to take you doing some things, doing some lifestyle changes. So not just now, you can do the lifestyle changes you can on your own. You can cut back on the carbs, not do the pound cake. You can start getting up doing the exercise and resistance training. But the reality is most people are struggling with doing all that. It's the consistency, it's the sustainability, right? But you can definitely do that. I like to liken the lifestyle changes as a fist fight. So, you can you can white knuckle it out with a fist fight. You both are on the same playing ground. But when you actually use the tools that we have, it's like bringing a knife to a fist fight. So it changes the game entirely. And so for my people who are like, okay, so I'm having all these symptoms. I don't know if I have insulin resistance. My doctor says all my labs are normal. Well, there's actually some labs to look at. Looking at your fasting insulin level, that's good. And your doctor doesn't check this. So you'd have to ask for this. They do check your cholesterol. So all they have to do is add an insulin level to this. And they usually do your cholesterol fasting. You just have to ask for it. Now, you want your insulin level to be less than 5, but you can also look at your cholesterol panel that your doctor usually checks and divide out the triglycerides by your HDL. And if that ratio is greater than 2, then yes, you very likely are struggling with insulin resistance. And then the whole waist thing, because when insulin's high and it stores the fat around your waist, having that larger waist circumference is going to be a nice indicator too, okay? And then, of course, if you're getting that fatigue after meals very often, that itis, that's a good indicator that your sugars are dropping low after eating. And it's dropping low because insulin's so high that it's attacking it and bringing it down low, okay? The whole point is, and I have my feelings so hurt that I was doing all that talking without my slides, but you don't have to wait. You don't have to wait at all. And so we're going to talk about the natural tools that are like bringing a fist to, bringing a knife to a fist fight that makes these lifestyle changes easier. That's what Dr. Esther is going to talk about. But let me show you some real life people, because that I know I have up. Let me show you some real life people with their results too. Yep. There it is. Okay, so this is one of my friends who was determined to tell me that she was the healthiest person I knew because she is that confident, right? Um, so 2022, there was a Tufts University study that said that 7% of Americans are metabolically healthy. And so my friend Beverly here, she was like, yes, I am that 7%. But when I started talking about skin tax, she said, okay, well, maybe something's going on here. So she started taking the products that we're going to tell you about, and she took a picture because she wanted to prove me wrong. So on May 2nd, and then on June 24th, she was like, wait a minute, some of these skin tags have actually gone away, and they definitely are so much smaller. I said, yeah, I told you exactly what I knew. And so she's been a believer ever since. And then Jim here, A1C of 12.2, and now it's down to 4.8. He's off of his blood pressure medicines, his IBS medications. His doctor took him off his type 2 diabetes medicines. I mean, in a much better place. Dr. Dieter, another physician who drank the Kool-Aid, pretty much like I'd like to say, he was able to, one, go from already trying to make lifestyle changes, doing intermittent fasting and running. Okay, that's what he was doing when he was in the black. 2 months of being on the Feel Great system, yes, he looks like he aged backwards, but his cholesterols have come down. I mean, they've even come down more than that. I had to write down notes the other day. I mean, they're down almost 100 points in a year, which is huge. And then we have the fact that it doesn't matter how old you are. Any age can benefit from using these tools. The lifestyle changes, sometimes it gets a little harder. Sometimes it gets a little harder to say no to the pound cake. Sometimes it gets a little harder to get off the couch. But these products, they level the playing field. And so we see an A1C going from 7.1 to 6.4. We see the waist circumference coming down because that's what we want. We want the visceral fat actually decreasing, right? That's what takes us out of here. Not having to manage a whole bunch of medications. I did think I saw Keith come on here, but I'm not going to make him talk because he talks all the time. But you know what I love about this picture with Sheridan? Somebody who was dealing with depression on 4 antidepressants. She was able to get off of them by using these products, literally taking back control of her health, okay? And yeah, our friend Keith, who has like lost a whole person. They say, I don't know if he was the one that said he lost a Backstreet Boy. I can't remember who said that comment before, but it just came to my head. And Tanya here, I love Tanya. She's the sweetest lady I know because one, struggling around with an oxygen tank 24/7. And she was actually able to reduce that to where she only uses it at night. Now she has a genetic condition, but the whole Feel Great system helped her with that. No more blood pressure, off of 4 medications, lost 45 pounds. I mean, really. And then Michelle, this is our little fast lady who sent me this picture today. So Michelle, we're going to hear her story in a little bit, but there are so many great people with wonderful stories and beautiful pics, but actually taking back control of their life. So I'm excited, and I want to let Dr. Esther tell us about this knife that we're bringing to a fist fight. So tell us about what we're talking about, Dr. E.
Okay.
And I see your page.
Okay. Can you see it?
Yes, you're good.
Yeah, I think we need to always cross-check that. Okay, so this system that we're talking about, the knife that we're going to bring to the fist fight, is called the Feel Great system, which makes a big part of the Feel Great protocol. When we talk about this protocol, we are talking about these 2 food-based products that are nutraceuticals, and we combine them with the science of time-based eating. And together they form what we call the Feel Great protocol. So the Feel Great system plus the science of time-based eating forms the protocol. And it's simple, it's sustainable, and you'll see exactly why. It's not one of those programs or one of those diets or a fad or something that you're going to do. I'm going to try this and, let's just see what happens. And I'm going to totally restrict myself. This is not the way I live. And in another 2 months, I'll try to go back to the way I live. No. As you heard from Miss Jackie, this is something that you just add to your life and it helps you change. Not only does it help induce the change, but it supports it. So it works to completely overhaul everything, your metabolism and everything, and also helps you adopt the right practices to continue making this sustainable. So what's the first product here? It's called Unimate, which is a ultra concentrated yerba mate tea, which has the active ingredient called chlorogenic acid. That's the main active ingredient. It also has some natural caffeine, and it also has theobromine, a lot of antioxidants. And what this does is we take this while we are fasting, and I'll talk about how we do that exactly. But what does this tea do? It supports well-being. People report it's actually why people say they're feeling great. It supports that feeling of just feeling great. It promotes feeling full, satiety, where you don't feel hungry. It curbs your cravings. And again, maybe that's why Miss Jackie now is saying she can let go of the cake. She doesn't feel that urge to always do the pound cake and the sweet stuff after dinner, because it helps curb those cravings. And how does it do that? It helps by naturally increasing your own body's natural GLP-1 hormone production by 67 to 70%. I know we talk about GLP-1s and we only think about the shots, but GLP-1 is actually a hormone that is produced in your gut. Anything else that's coming in form of a pill or a shot is a cloned version. It is not the natural thing. This tea here helps you increase the production of to boost the production of your own by 67 to 70%. And because it's your own GLP-1 hormone, it doesn't come with the side effects that the clones come with. It also helps increase endurance. It promotes fat burning. While you're burning fat, what you do is that you produce ketones. Now your brain loves ketones for energy. So when you're doing that, you have more mental focus, more clarity. That brain fog that a lot of people talk about is cleared when you're taking that. And it also supports the healthy cognitive processes. And of course, with all these things that it's doing, then it is supporting weight management efforts. It helps keep your blood sugar low. It helps you to fast, because when you're taking it, you don't feel hungry. You don't have those cravings. So you're allowing your blood sugar to go down and therefore your insulin to go down. Dr. Tiffany talked about it and said when insulin is high, then you're ending up storing things. You want that insulin to be low so that you can start burning the stored energy for fuel. So this tea helps support all that. And as I said, we enjoy it any time of the day, particularly when you're not eating. When you wake up in the morning, that's when we take it, so that it helps you extend your overnight fast, and so that you're not feeling hungry, and you can actually extend your fasting through the night and maybe until lunchtime, make it about 14 to 16 hours. It prevents getting all those crashes, feeling like you're going to eat the next person or the next thing that you come across. And it helps promote healthy digestion too. You can take it at whatever temperature, hot, cold. It's to be enjoyed in any in various forms. The other product is the Balance. Balance is a blend of 7 different fibers. It also has multivitamins added to it. What does it do? We take this as a pre-meal drink, and what it does is that it helps curb your appetite between meals because it keeps you full. It is fiber, so when you take it before your meal, you stay fuller longer. You also don't have a glucose spike because you're not absorbing all this glucose from the food that you've just eaten. You're not absorbing it very quickly. It delays that absorption. So you don't have a glucose spike and therefore no insulin spike. And therefore you won't have a crash. If you don't have a spike, you won't have a crash. Everything is all a gradual rise, kind of like rolling hills. It also helps reduce the amount of dietary cholesterol that you absorb into your bloodstream. Also reduces the carbohydrate absorption. And this product has actually, for those two things, it's been studied by the Cleveland Clinic, and their conclusion was that if taken regularly, balance could actually reduce cardiovascular risk on a population level and actually decrease the need or dose for lipid-lowering prescription drugs. And we know the leading lipid-lowering prescription drug is the statins, the pravastatins, lovastatin, simvastatin, whichever statin you're taking. The other things that it does, fiber is the ultimate prebiotic. That's what your gut microbiome needs. So it helps support good gut health and all the advantages of good gut health that we know. You know, the diseases that come from gut microbiome imbalance, IBS, Crohn's disease, constipation, diarrhea. Then your gut microbiome supports your immune system. 70% of your immune system resides in the gut. So if you have a good gut microbiome, then you're also taking care of chronic inflammation and all the immune diseases, helps deal with autoimmune diseases. We've had patients who've had Hashimoto's thyroid, because that's an autoimmune disease, come off that low dose medication, or even reduce, even if they're on a high dosage, including people without a thyroid. They still end up with a reduced dosage of the levothyroxine that they have to take. And because it again reduces how fast your glucose is absorbed, so you're not going to feel hungry in between your meals. You can actually stay the 4 hours that we recommend to have between meals because you're not feeling hungry. If anything, what happens is that you end up eating because, well, it's time to eat the next meal 3 to 4 hours before your bedtime, but not really because you're feeling hungry. And that's what we want. We don't want you to get hungry and start making the wrong decision. So it helps augment the need for making the right decisions when it comes to your food. And as I said, we take this as a pre-meal drink. You just mix it usually with room temperature water, cold water, and you take it bottoms up about 5 to 10 minutes before your meal. This is how we take this protocol. Overnight when we sleep, we're naturally fasting. So when you wake up in the morning, you've probably been fasting for maybe 10 to 12 hours from when your last meal was. So you want to extend that by another 4 or so hours to make 16 hours. And therefore you take your Unimate. Well, you're taking it, it's doing all those good things, promoting fat burning, which already is happening because you're fasting. So your body is burning, is eating your love handles for breakfast. So you take this and it accentuates that. Then at lunchtime, you take a protein-heavy meal with a lot of fiber and good fats. And if you're just doing, then you can do another Unimate in the afternoon. It helps with that sleepiness sometimes people may feel, and it also helps you not feel hungry between your lunch and your dinner. Before your dinner, for most of us, that is the largest meal of the day or the most carbohydrate heavy. You take your balance. And when you do that, then you're good until the following day. You're allowed to drink water. You're allowed to drink any other calorie deficient drinks that don't have like artificial sweeteners or anything like that. So if you want to take this extra balance, sometimes people decide they're just going to do 2 wholesome meals and therefore can do another balance before lunch. But the way the protocol usually comes for most beginners is that you take 2 Unimates a day and 1 balance a day. So what makes these products different? First, we have now over 25 clinical studies that support everything that we're saying. This is not just claims that we're getting out of nowhere. We have clinical studies, both internal and external, so there's third-party validation. It is HSA and FSA qualified if you have that. They're nutraceuticals, so there are no pharmaceuticals in them. You don't have to worry about that. This is all natural product. It's now available in actually over 65 countries, patented, and there's a guarantee. If you start taking this protocol, we do have an app that helps you track while supporting your journey through this. And if you take it as it is indicated and you see absolutely no results, the company so believes that you're actually going to see results that it gives a 90-day money-back guarantee if you do not get if you don't get the results you were looking for. It is there in the physician desk reference or physician digital reference now. So if you're wondering, can I take this? What will my doctor think? You can have them look it up in the physician desk reference. It helps with determining whether does it interact with the medications you're taking. And I can tell you, because again, it is food, unless you've been told you cannot eat, which I doubt anybody is told you cannot eat. So as long as you can eat, you can take this. So the cost, it ends up being cost neutral. It costs about $5.26 a day. For most people, that is less, probably a third or even a half of what they spend on breakfast. And when we're not even counting all the snacking that people do currently, and you're going to stop that, because remember, you're not going to be eating anything in between your meals. So no snacking, no sodas, no all those energy drinks that you take now because you're just trying to get through the day. So it ends up actually not just being cost neutral, actually you end up saving lots of money. As I said, we have dedicated in-house scientists, the third-party certifications. If you want to see any of these things, the person who invited you to this call can help provide all this data. But yeah, it is all there. And as Dr. Tiffany has already showed, we know that these products are helping lots and lots of people, starting with ourselves here. And because it has helped us so much, that's why we're talking about it to other people. And we have one of those people here who's willing to share her story, and I will let Dr. Tiffany introduce her.
Yes, yes, yes. That was great, Dr. Esther. Thank you so much for putting that on there. You did a great job explaining the products. We're going to try to hit some questions at the end, but I want to introduce you to the lady that was looking all super fine in that last picture. I'll put it up again. Our guest to be able to tell us about her story. Michelle, or Shelly, like she is on social media. So thanks so much for coming on, and I'm excited that you're going to share your experience, because everybody's experience is different, because we reach so many people with this metabolic health product that there's so many things people have that improve. Jackie had her back, and the fact that she was, so disrespectful to her body with her pound cake, like she likes to say. And your story is so much different. So thanks, Michelle. Go ahead and tell us where you were when you found the products and what the products have done for you. And you have the stage.
Okay, thank you so much for having me. First of all, I just want to say thank you. So I started this protocol about a year and a half ago. I was hoping to lose some weight because after we had our second son, he was also our miracle rainbow baby, because the PCOS that Dr. Tiffany talked about, I have. I also have, which is the leading number one cause of female infertility. So many, many struggles over the years, lots of pain, lots of suffering, ovarian cyst burst over the years. I was hospitalized for it. It's a very painful condition at times. And I also have another female infertility condition, which is autoimmune related, which is endometriosis. Wreaked havoc for decades on my gut health as well as my brain health, causing me massive brain fog. Also, like Jackie, I have a bulging and a herniated disc in my lower back. So I used to see the chiropractor probably about 2 to 4 times a month, and now I might see him 2 to 4 times a year. So this right here, I'm telling you, the protocol itself, as well as this, which greatly reduces inflammation in the body. This is the tea, has chlorogenic acid in it, greatly reducing that inflammation, has totally changed the game for my back pain. Also, I have osteoarthritis, like Jackie was sharing. The backs of my heels would be so excruciating. Every morning when I woke up, I couldn't even walk like 7 steps to get to the bathroom upon waking up, because the backs of my heels, the osteoarthritis pain just was excruciating. So then one day I realized, all of a sudden, oh my goodness, I took a step without thinking about it and I didn't have pain. And so it was quite amazing that I didn't have that pain, but I also struggled for decades. Thank you guys so much for the love. I appreciate that. I struggled for decades with anxiety, brain fog, gut issues, skin tags, you guys, on my neck, on my back, many skin tags. Those are all, you'll probably see, but they're all completely gone. Also, inflamed gums. I would go to the dentist. My hygienist would actually give me a number. And I flossed religiously. And she would say, "Are you even flossing your teeth?" When I was a teen. And I said, "Yes, I floss every day." And she said, "Your gums are so inflamed." She'd give me this high number every time. And she said, "Next time I want that number to be lower." I was always getting chewed out, like, pardon the pun, but I was literally always getting chewed out every time I went to the dentist because I had those inflamed gums. I didn't know back then what I know now. That is because of insulin resistance. Also, like Dr. Tiffany shared, the dark circles under the eyes, had those for years. I don't wear makeup really, but I would be putting like cover up because I was so embarrassed of having these dark circles every day. And let me think what else. And dropped 3 pant sizes in 4 months. The bathing suit picture Dr. Tiffany shared, that is a difference of 6 weeks. And I went from having that bloated belly, the start of the mommy muffin top, had that bloated belly for years. 6 weeks, I dropped 2 pant sizes. So I'm going to be very transparent though. I only saw 8 pounds move on the scale, but even better than that, yeah, it was 2 pant sizes I dropped here. Only 8 pounds were moving on the scale. But as you can see, my bloated belly is completely gone. That was 6 weeks difference, those 2 pictures. And the mom fluff is gone. The start of those saddlebags gone. So yes, there is my, I was in a size 10. Within 4 months, I was wearing a size 4. I have stayed a size 4 in a year and a half that I've been taking this protocol.
Wow, that's the best part, is the staying. Because so many times people are
Right.
like, okay, is it going to be sustainable? And yes, I love that. It is sustainable. So yes, love that, Michelle.
Thank you.
Yes, yes, yes. Love your story. Thank you for sharing
Thanks.
that, because you had some
Yes.
great things. Perfect, perfect, perfect. Well,
Thank
you
you.
know what? I think it's time to bring people back to see if anyone has any questions. What do you think, Dr. Esther?
Yes, I just wanted to pick up a couple of things on what Michelle said.
Mm-hmm.
One, the inflamed gums, which is called gingivitis. This is something that, we think that has to do with brushing teeth and how well you're taking care of your teeth. But I want you to think of the cavemen. They did not have gingivitis or any of that stuff. What is really causing this is the chronic inflammation that we have from everything that we've done to our bodies with the processed foods, with high sugar levels in our bodies. So when you're told that you're having gingivitis or there's something, you have a lot of inflammation in your mouth, don't take it that you're not doing your dental hygiene the way you should. You should dig deeper and realize that there's something else going on that has nothing to do with how well you're flossing or, what kind of toothbrush you're using. There's much more to that. The other thing, is Michelle said, she only dropped 8 pounds, but you have seen the change in her size, the sizing of the clothes. And that's the thing with this protocol. We don't lose muscle. What you do is lose fat because muscle is heavier than fat. So what you do is that the scale may not move as much as the clothing size. And that's what you want. You want a lean, toned body. You do not want to lose muscle. Muscle is the organ of longevity, and you want to hold to every pound of muscle that you have and actually keep building. So, don't just look at the scale, look at the feet of your clothes.
Mm-hmm. Mm-hmm. I mean, I like to joke because when we were growing up, there would be that commercial of I've fallen and I can't get up. Well, look, that's not what I'm trying to do in my 70s and 80s. Okay, I need to be able to get off the floor. I saw some meme or some video of this elderly woman climbing a gate to get out of a nursing home. Yeah, that's exactly what I want to be able to do. I want to be able to scale a fence. If I can't scale a fence, at 70s and 80s, I didn't do what I need to be doing. So yes, resistance training is huge. Love that, Dr. Esther. Love that. Well, since we're all on here, if you have any questions, here's your time. You got 2 doctors, you have 2 ladies with some amazing stories. Here's your time before we close on out for the night. And if we don't, that is okay too. So that is okay too.
There's a
So
raised
ladies.
hand,
Oh,
Doctor.
Dr. Cora. Oh, I think you can oh, you might not be able to unmute. Let me unmute you. Mute. Yeah.
Oh, I can. I just wanted to
Okay.
the protocol. I wanted to raise my hand. So I've heard. I'm sorry. I had to go put on my BJ's because it's really past my bedtime. But my question is, I see that we're in PDR, and I've heard a lot of times that you could get the protocol can be prescribed by your doctor. Is that true, or did I just hear wrong? Not your
What?
doctor,
Yeah.
your
Yeah. What
health, your
you're
health care.
referring to is the flexible spending account and health savings account. So if your doctor says that this is going to be helpful for your health, they get you a letter of medical necessity, and that allows that to be covered under that account if you have that.
And that's
HSA or FSA.
from your health care program.
HSA or FSA, those are the names of those two programs.
Thank you.
Mm-hmm. Yep, and it looks like Trinika has her hand up. So yes, you can unmute and ask your question, please.
Hey everybody. My question I want to ask, my husband and I have been on the protocol probably about 6 months. He looks good, but he looked good before we started, but he's really looking good. Again, I hear you all always say don't look at the scale. Mine is probably about, I look like I can't get out of that range, but I do feel good. I'm sleeping better at night. But again, I'm like Miss Jackie when she said with this the sweets. Mine may not be sweets. I do hair, so sometimes I may just pop a drink, and I got my tea right there. And I guess my question I want to ask you: I never stopped doing the protocol. I keep doing the protocol. Am I wasting my money? When I say that, I'm not saying I'm gonna stop doing it, but am I wasting money when I grab a drink? I have the rice, with a meal. Am I wasting my money?
Well, absolutely not, because we have Miss Jackie eating her pound cake all the time. No, absolutely not, because the balance itself is going to decrease that post-meal glucose by 43%. So if you're taking the balance, it serves a good transition until you're able to make all the changes. So one good thing about this protocol is that we get connected with the sponsor to be able to talk about what we're doing, how we're eating. And then at the app that we have now, you can actually copy what you're eating on there, which is really great to give you an idea on how many carbs you're doing, how many proteins you're doing. If you're doing more protein, you'll find you'll have less of a carb craving too. So there's some tricks. There's some tricks and tools to do to help, but absolutely not. I mean, even people who don't have any medical conditions, using these products is actually preventative. So yes, this is something that everyone can use, and you're not wasting money at all with doing your drinks or your pound cake like Miss Jackie does.
Okay, I just asked. I did invite my mom on, who we're about to start the protocol. She's 82 years old on 4 blood pressure medicines. They just took off the statin because now they're saying that fatty liver disease is it's showing liver enzymes are up. So I'm excited about getting her started. She's using a couple of samples that I've given her, but she wanted to hear everything that I didn't know.
Yeah, and it's really good for fatty liver. So I'm really excited to hear that. So I can't wait to see her results.
We have another hand raised, Dr. Tiffany. It's Barbara.
Yes, we do. So Barbara, go ahead and unmute.
Hi, I have possibly 2 questions.
Okay.
One, when you take it as a tea, do you put the whole packet in a regular teacup? I know it's a really off question, but I want to try it like a tea, but I'm not sure because already when you use it in the bottle, it's a lot. So I'm wondering, how do people take it in a tea? If you just pour it in a regular teacup and add hot water to it. And then my mother is on high blood pressure and some other medications. If she were to take this, does she need to wait hours between when she takes her medication and then take the protocol? Or can she take it like right away after taking her meds?
Okay, I'll take that question, Barbara. So when you when you take the tea, the Unimate, so you have a bottle, right? You said you have a bottle that
Yes, I
and
have the
you know how
bottle.
much water to put in
Yeah, for the
one
tea.
pack into that. Yeah, so if you're taking it cold, definitely the plastic, that the regular diamond bottle helps. Now, for me, I like particularly my morning tea hot. What I have just done is that I use a taller insulated coffee mug, and what I do is I put hot water into it,
Uh-huh.
or whatever temperature, because I like mine hot, so I want to take it like a a hot tea.
Yeah.
And the first time I bought it on subscription, I got that little frother, the Stara, because
Uh-huh.
obviously when it's hot water, you're not going to shake it. That's going to be an
Yeah.
accident that you don't want. So that's what I use. I stir it. And
Okay.
sometimes I may put a dash of cold water just to make it, because you don't want it to be boiling. Otherwise, you're never going to be able to sip on it, so that I can at least start sipping on it. And then I just sip on it slowly. And what I find why putting it in an insulated cup helps is because then it's going to stay hot and I can sip on it slowly, because you don't want to drink this quickly. Like, you drink other drinks over half an hour and then you're done. No, you want to sip on this slowly, like I sip on mine, over 3 to 4 hours in the morning. I do drink water in between. So on my desk, I always have my hot water insulated mug with the Unimate, and then with a bottle of water, so that I'm sipping
Okay.
on it too, because you really need to keep hydrated. So you don't want to just take the tea as the only fluid that you take. You want to still take a lot of water. So yeah, that's the way to do it. You can put it in an insulated cup and just keep sipping on it. As far as your mom is concerned and taking medications, there is no contraindication to taking this with medications. So this does not break your fast. You can continue. High blood pressure medications can be taken together with it, depending on what time she takes the medications. She can take, there's no reason why she shouldn't take her blood pressure medications because she's taking the matter, or vice versa. Now, people who are taking things like thyroid medications that need to be completely taken on an empty stomach, of course, something like Balance, which is a pre-meal drink. So, if you're taking it, it means there's a meal coming up in about 5 to 10 minutes. So there shouldn't be thyroid medication anywhere in the vicinity of that, because that needs to be on an empty stomach. So that's the one thing, those medications where they've said completely on an empty stomach, that's a different thing as opposed to just blood pressure pills.
Okay.
Yes.
Thank you.
Yes, that was a great question. Thank you for asking all that, Barbara. Well, okay, ladies, we don't like to hold people longer than their time, because we know how much everybody sacrifices to get on these calls, and it's getting late, especially for our people on the East Coast. So, Miss Jackie, do you have anything you'd like to share? Any parting words for anybody who's thinking about the products?
I'll actually quickly, Trinika, you said, what about leg cramps when I'm on the protocol, protocol?
Okay, I didn't see that.
Yeah, so sometimes people do get, because of when sugar starts shifting, you do get some electrolyte shifts. And what we have found is that sometimes, Unicity now does have a product called Signal, which is very clean electrolytes. So you can take that, and that helps with those cramps. But if you don't have that, a simple way is taking mineral salts, something like the pink Himalayan salt or Baja salt. And it happened one time when you suddenly feel like I was feeling like I'm getting a leg cramp, and just taking a pinch of Baja salt and putting it under my tongue. And it worked like magic. The cramps went. So that's something that you can do if you feel those cramps. Yep.
Yep. And Alan has a good result about his wife. That is great. Thank you so much for putting that in there, Alan, too. Okay, Miss Jackie, your parting words, and then we're going to do Michelle, and then Dr. Esther's going to close us out.
So I would say, if you're on the fence about it, there's really nothing to lose. And my experience of the Feel Great system is it's the gift that keeps on giving. So it's more forgiving of myself than I am. And so I'm just thankful for just being able, well, first of all, thankful that you all just were accepting of my testimony. I just try to be authentic when I talk. But anyway, and I just, yeah, you have nothing to lose. And I would say go for it. Yeah.
Yes. It's you, Michelle.
Yes. So I totally agree with Jackie because I've done holistic things over the years, but like I said, I have autoimmune issues, the brain fog, the chronic exhaustion, chronic inflammation with so many different issues, and nothing I've ever used has reached everything. Like I said, the anxiety, the back pain, the osteoarthritis pain, the brain fog, the let me see. I have a list, you guys. It's literally so long I have to have a list. And I have struggled with most of these since my teens. So to find one thing that addresses all of them and helped me lose weight too was I mean, beyond mind-blowing to me. Because like I said, I've been doing holistic things for several years. And I did grow up in the 80s where I ate horrible. And I feel like that's why I got to this place, even though the last like 10 years I've been eating pretty healthy. But it couldn't undo all that damage until this got to the root of the problem of that insulin resistance and really just turned things around. So, like Jackie shared, with a 90-day happiness guarantee, which your medications don't even offer that. You literally have nothing to lose. Mark your calendars for day 85, day 88. And as long as you use it properly, we do not see it letting people down. So just use it properly and follow the steps that your coach gives you. And you guys, I'm telling you, just the changes that I've experienced, that others have experienced, are truly mind-blowing.
Yes, yes, yes.
And it's so simple. I love that it's so easy. Like, we are going on a trip. This is the first thing I packed, you guys. I literally, right here, I have it. I have it at my desk. The first thing I pack is this right here. I literally stick it in my suitcase, and I have a Ziploc bag, and our whole family takes it. It is safe even for kids. Our boys are 14 and 10. We are actually heading out to Frisco, Texas very soon, in less than 2 days, because our oldest son is a very super competitive soccer player. So he is one of the few kids, he's the only kid on the team they never take out. They never take him out. He never gasses out. He's not in pain with his muscles. And I'm telling you, I attribute it to this right here because of what it does for inflammation in the body. Thank you.
Yes, yes. Thank you, Michelle.
Yes.
Okay, Dr. Esther, take us home.
Okay, thank you so much. Thank you, Jackie. Thank you, Michelle. Thank you for your wonderful testimonies. And thank you, Alan, and everybody else, Trinika, everybody else, Rich, that put their testimonies on the chat. And thank you for the wonderful questions. We always like when people ask, and so that we can just make this more relatable. Now, I think we can all say we've had some hopeful news. And whenever you hear the message of hope, you want to share it with somebody. First, you want to lean and grab onto that hope. And therefore, if you're here and you're just wondering, you've had yourself mentioned when we were talking about all the things that could go wrong with our bodies. You saw Dr. Tiffany talk about you while she was talking about all the symptoms, and you're like, yeah, that's me, that's me, that's me, yeah, that the skin tags, that's me. Here's your chance. We're telling you that there is hope in something very simple. You don't have to wait to go see a doctor, to go elsewhere, to go get it prescribed. All you have to do is reach out to the person that invited you to this call, get that link, get a discount link, lock in your discount for life, and order it. And you get support from that person throughout, and you come to calls like this. Now, the next thing that you do once you've taken care of yourself, you put on your life vest first, is invite the people around you. You want to make sure that they also get their life vests on. So please invite more people to come and hear about this, share this information with them, invite them to these calls, as we said, every Wednesday, except the one Wednesday when there's a company webinar. So we're going to be here at least for the next 2 weeks. I think, yeah, we usually on for 3 weeks and then off for one per month. So please invite them, same time, same link. So whatever link you have, it's the same link, same day. Bring them on, let them bring their questions, let them bring any skepticism, we'll help dispel it. Thank you so much for sharing your time with us. We appreciate it.
Thank you. Good night. Good night.
Good night.